something important that we have to understand. For better results and sustained results, we have to understand that our body do not carry myofascial tissue. No book of histology will support it, and even anatomical theater, the real views will not support it. Our body carry myofascial tissue. We carry alliance, fascia and muscles. Muscles surround by fascia. And the big difference and crucial fact for us, for successful results, is that fibers of muscles containing this potential to constrict, but fibers of fascia cannot. Therefore, I propose to you the techniques of connective tissue, fascia mobilization of Professor Duclair. Was good kind of data that we're utilizing. We will detect abnormalities, tension in connective tissue. The technical approach is pretty easy. You just have to use third and fourth finger to fold a little bit skin under fingers and just to pull to yourself. Now, connective tissue massage actually working in a form like if I would like to straight this bed sheet, I will push to the sides, to different sides, and until I will stretch. In the same manner we perform. We fold first of all, and after this we perform. You can use even 2 fingers. Connective tissue massage is a very important component of medical massage. Just like this, you fold, but what's very important to pull to yourself. If you will try this way, it's just the skin will give you a little bit different indication. Now, connective tissue have few layers. The superficial fascia, actually we're mobilizing with 2 fingers, and actually, as I demonstrate in bed sheets, we can release in one procedure if we will work this manner by pulling to us in a different direction. Connective tissue in original modern massage procedure was proposed by Austrian physical therapist Duclair in 1930s, and she even proposed the direction of massage. I personally think it's helpful, but just to keeping in mind that we want to stretch and straighten this connective tissue will help us to reach very important results. Now, the second layer of connective tissue, it's a deep fascia. With this technical approach is very difficult to reach. Therefore, the mobilization of deep layers of connective tissue, we're doing like this. We're putting hands, we stick our palms to the body, we stretch maximum, we're releasing. And again, we will do this in a different, and of course in lower back area we're doing the same. Any area that we will treat, this is extremely important part of medical massage procedure is what we call myofascial tissue release, but this actually connective tissue massage, and you can on both vertebrae. The same manner we can use and we utilize on extremities. Later on I will demonstrate in different parts treatment in different pathologies I will mention, and I will utilize this kind. And again, you just put the flat both hands in the body of your clients, you stretch maximum and you release, and you release. And in this case, you very effectively mobilize the deep connective tissue. The other abnormalities is pathologically the development of pathological hypertonus in muscles, and of course trigger point development. Trigger point therapy is very important part of medical massage. It's very important to detect trigger points and to eliminate them. Trigger points is nothing else than a localization of pain. In one area, and especially if this is sport-related injuries, and in a type where is a whiplash involved, and sprain strain act and contusion, and this is in one injury, could be involve these physical effects on our body. Trigger points could be in many locations. Therefore, very important to discover them and to eliminate them.